Scene script. Have you ever wondered what diabetes really is and why it has become so common? To put it simply, diabetes is a chronic condition that affects the way our body processes blood sugar, or as scientists like to call it, glucose. Glucose is vital for our health because it's the primary source of energy for the cells that make up our muscles and tissues. Our body breaks down the food we eat into glucose and releases it into our bloodstream. And here's where insulin, a hormone made by our pancreas, comes into play. Insulin acts like a key, unlocking our cells to let in the glucose we need for energy. But what happens when this system doesn't work as it should? That's when we encounter diabetes. There are two main types to consider: Type 1 and Type 2 diabetes. Imagine Type 1 diabetes as a case of mistaken identity. It's an autoimmune condition, which means your body's defense system turns against itself. In this case, the immune system destroys the insulin-producing cells in the pancreas. Without insulin, glucose can't enter the cells and builds up in the bloodstream, leading to high blood sugar levels. On the other hand, Type 2 diabetes is more like a broken lock. In this condition, your body becomes resistant to insulin. The keys are there, but the locks on the cells don't work properly, so the glucose can't get in and again builds up in your bloodstream. In response, your pancreas might produce even more insulin, trying to get the glucose into your cells. But over time, it simply can't keep up and starts to produce less and less insulin. Both types result in the same problem: too much sugar in your blood. This can lead to serious health problems, including heart disease, vision loss, and kidney disease. With diabetes being a global health concern, understanding it is the first step towards prevention and management. Whether it's you or a loved one dealing with this condition, knowing what's happening inside the body can be a powerful tool in managing diabetes effectively. So, what causes diabetes and who is at risk? To start, it's essential to understand that diabetes is a complex condition with a myriad of causes, many of which intertwine with one another. One of the primary contributors is genetics. Yes, your DNA plays a significant role. If your parents or siblings have diabetes, you may have inherited a predisposition to the condition. But remember, genetics is not destiny, and having a family history doesn't mean you'll inevitably develop diabetes. Now, let's talk about lifestyle choices. Unhealthy eating habits, such as consuming large amounts of processed foods, sugary drinks, and unhealthy fats, can lead to obesity. And obesity, my friends, is a big red flag. It significantly increases the risk of developing Type 2 diabetes. But it's not just about what you eat. Lack of physical activity is another major player. Regular exercise helps control your weight, uses up glucose as energy, and makes your cells more responsive to insulin. So when you're not active, the risk of diabetes increases. Now you might be wondering, what about age and race? Well, you're right. As you grow older, the risk of developing diabetes also increases. This is likely due to the loss of muscle mass and gain of weight that often occur with age. Additionally, certain racial and ethnic groups, including African Americans, Hispanics, Native Americans, and Asian Americans, are at a higher risk. And lastly, let's not forget about family history. Yes, if your mom, dad, or siblings have diabetes, your chances of developing the disease increase. But here's the good news. Knowing these risk factors empowers you to take control. You can't change your age or genes, but you can certainly adopt healthy lifestyle choices. Regular exercise, a balanced diet, and maintaining a healthy weight can go a long way in preventing or delaying the onset of diabetes. Identifying these risk factors can help in early detection and prevention of diabetes. How would you know if you have diabetes? What are the symptoms to look out for? These questions are common when it comes to understanding this condition. Let's break down some of the most common symptoms of diabetes. Frequent urination can be a key indicator, especially if you find yourself waking up multiple times during the night to use the restroom. Then, there's excessive thirst, a symptom that goes hand in hand with frequent urination. As your body works overtime to get rid of the excess sugar in your blood, it can leave you feeling incredibly thirsty. Unexplained weight loss can be another surprising symptom. Despite eating regularly, you might find that you're shedding pounds without trying. This happens because your body isn't effectively getting glucose from your blood into your cells, so it starts burning fat and muscles for energy instead. Feeling fatigued is another common sign. When your cells are deprived of sugar, you may feel tired and out of sorts. And then there's blurred vision. High levels of blood sugar can swell the lenses in your eyes, distorting your vision. Identifying these symptoms is a first step, but how can a doctor confirm a diagnosis of diabetes? Well, there are several tests a doctor can administer. One is the fasting blood sugar test, which checks your blood sugar levels after an overnight fast. high levels could suggest diabetes. Another is the oral glucose tolerance test, which measures your body's response to sugar. 2 hours after drinking a sweet liquid, your doctor will test your blood sugar levels. Again, high levels may indicate diabetes. Finally, there's the HbA1c test, also known as the A1C or glycated hemoglobin test. This test provides an average of your blood sugar levels over the past 2 to 3 months. An A1C level of 6.5% or higher on 2 separate tests indicates diabetes. If you experience any of these symptoms, it's crucial to seek medical help promptly. Remember, early detection can make a significant difference in managing diabetes and preventing complications. It's always better to be safe than sorry. Is diabetes a life sentence? How can you manage this condition? Let's delve into this. Diabetes, while a chronic condition with no outright cure, can be effectively managed. The key lies in a well-rounded approach that includes medication, diet, and exercise. A cornerstone of diabetes management is medication. Depending on the type of diabetes, insulin injections or oral medication might be prescribed. Always remember, it's crucial to take your medication as directed by your healthcare provider. This helps maintain blood sugar levels within a target range and prevents complications. But don't just stop at medication. Diet plays an incredibly pivotal role too. A diet rich in whole grains, lean proteins, fruits, and vegetables is often recommended. And it's not just about what you eat, but also when and how much. Regular meals and snacks can prevent blood sugar spikes and crashes. A registered dietitian can help you craft a meal plan that fits your personal health goals, food preferences, and lifestyle. Next, let's talk about exercise. Regular physical activity helps your body use insulin more efficiently, lower your blood sugar level, and can also help you lose weight if that's a goal. This doesn't mean you need to run a marathon. Even a brisk walk or a short bike ride can do wonders. Monitoring your blood sugar is another essential part of diabetes management. Regular checks can help you assess how well your diet, medication, and exercise regimen are working. Your doctor can guide you on how often you need to check your blood sugar. Finally, maintaining a healthy lifestyle goes a long way in managing diabetes. This includes regular checkups, getting enough sleep, reducing stress, and quitting smoking. Managing diabetes might seem challenging, but with the right approach, it can be effectively controlled. Remember, the aim is to live well with diabetes, not just to live with it. And with knowledge as your tool, you're already on the right track. Can diabetes be prevented? How can you reduce your risk? These are questions that we must all ask ourselves, and the answers may surprise you. Yes, diabetes can indeed be prevented, and there are several ways you can reduce your risk. One of the most effective preventative measures is maintaining a healthy weight. Excess weight, especially around the waist, can increase the body's resistance to insulin, leading to type 2 diabetes, so it's important to keep those extra pounds at bay. Another essential step towards prevention is eating a balanced diet. Consuming foods rich in fiber and low in fat and calories can help you manage your weight and keep blood sugar levels in check. So, fill your plate with whole grains, lean proteins, and plenty of fruits and vegetables. And remember, moderation is key. Physical activity is another crucial part of the prevention equation. Regular exercise helps control weight, uses up glucose as energy, and makes your cells more responsive to insulin. Whether it's a brisk walk, a bike ride, or a yoga session, try to get at least 30 minutes of moderate intensity activity on most days of the week. And let's not forget about regular checkups. Routine screenings can catch prediabetes or diabetes in their early stages, when they're easier to manage or even reverse. So, don't skip your annual physical, and make sure to discuss any potential symptoms or risk factors with your healthcare provider. Preventing diabetes is not just about avoiding a diagnosis. It's about making lifestyle modifications that will improve your overall health and well-being. It's about making choices that will empower you to live a fuller, healthier life. So, take charge of your health today. Start small, make one change at a time, and gradually build up to a healthier lifestyle. And remember, it's never too late to start. Remember, prevention is always better than cure. Stay informed, stay healthy.